LinkedIn, I decided to make 2 videos. So we are live again. Very exciting. First, let's just talk about something, and it is educating you without concerning you about having to put your life in just constant worry and concern. One of the things I'm going to talk about is lymphoma. Lymphoma is a blood cancer. It's a type of blood cancer that is very common in younger populations. Now, there has been connections to lymphoma, but there has not been direct correlations to lymphoma. For example, HPV has over 400 types of HPV. A few years ago, they put it down to 300 types of HPV, but there's only 6 strains that are of danger. So you have 396 strains that pose no risk to your health. However, men cannot be tested for HPV. Only if they are with a parent party, which would be a female, which would be a girlfriend, wife, whichever it is, can they then figure out if they have HPV, unless they then have physical symptoms of HPV. But the funny thing is, the physical symptoms of HPV in men are low risk. So a woman goes in to her OBGYN, she has a pap smear done. There seems to be abnormality on the cells as they're read through. Maybe they did a wet slide, maybe they sent it over to pathology, but they got a reading and there seems to be something abnormal. They can actually detect which type of strains of HPV this patient will have. Now, because HPV is a normalcy, and they say by the time somebody turns 50 years old, there'll be an 86% chance that they have every single strain of HPV, plus or minus the high-risk strains. We just associate this with common. Like, you're going to get the flu in your life, you're going to get HPV. It's not a very big deal. However, the high-risk strains are crossing links with certain lymphomas. Now, I'm not going to denote what type of lymphomas are out there, but I'll make it very simple. You may have heard of non-Hodgkin's or Hodgkin's lymphoma. Those are not the only types of lymphoma. There are very different types of lymphoma, but they go in a strong clinical assertion that maybe not everybody will understand. So we'll stick with the 2 basics, and then there is a type A and a type B. One has a regulation of symptoms that you will mimic on a Google form, and you will see yes, yes, yes. Others are type B that do not present the same symptoms, but there seems to be a persistency in the symptoms itself physically, and we'll discuss that. So the second link from HPV to lymphoma seems to be what they call Epstein-Barr virus. Now, the Epstein-Barr virus is another name for mononuclear. I would just call it mono. So we'll say that mono, generally in your young teens, you end up experiencing mono at some point in your life. It really takes you out of commission. 2 to 3 weeks, you are very sick, you lose a lot of rapid weight, your appetite diminishes, you start to get spotting in your throat, in your tonsil area. Doctors can pretty much pick that up right away. However, because it's of the herpes family, there are other associations within Epstein-Barr virus, and Epstein-Barr virus can actually be associated now with GERD and gastritis, which is an inflammation of the lining of the esophagus and stomach through erosion and acidity. So the funny thing is if you're thinking of a blood cancer, I want you to really understand what that means. That means it is actually channeling through your blood. Now, sometimes it starts in the lymph nodes, and that's where you get the name lymphoma. However, it can start in other regions of the body. If you end up having a severe case of GERD and gastritis, it can very well manifest itself into something different. If you are looking at the prognosis, if you're looking at the prognosis of a patient with abnormal blood readings, you could be looking at certain leukemias. So let's look at what Google is saying about lymphoma, and let's talk about the reality of lymphoma. Anytime you type in something where you have abnormal lymph nodes, we'll just call them enlargements, Google says you have cancer. It shocks everybody. It causes people to go into a prone levels of anxiety. Your appetite dissipates. You start to lose weight. You're not filling out your shirts appropriately. You start to put stressors on your life that are actually being degenerative to the symptoms you currently experience. Anxiety has been proven to actually kill people. You can have anxiety levels so high, and that manifests itself over a certain period of time, that it would be worse than if you did have lymphoma. So let's make it clear that 90% of the time plus, it's not something that is that dangerous. And now we're going to go into symptoms. So typically with lymphoma, before you have enlarged lymph nodes, if that's what does come to pass, you start to have abnormal reactions to certain day and nighttime activities. So when you sleep and you catch a cold, your body's going to ache. You might sweat a little bit, but it's not going to be profusely enough to sweat through your pajamas, your underwear, anything like that. And I mean sweat dripping off your body. If you have the flu, that can happen, but it goes away. And that's called breaking the fever. But if it is continuous, and you're talking about drenching night sweats, and sometimes you get really itchy on your back or on your calves, not from dry skin, that's where you start to get concerned. If you start to see enlargement within the cervical lymph nodes, not just lymph nodes that you can palpate and feel, lymph nodes that are poking out, lymph nodes that are enlarged, and there is no sign of you having a cold, a sickness, a virus, that is an alarming concern, because you got to remember what the lymph nodes actually do. They fight the invasion. So if cancer is present in the body and in that lymph node and in those series of lymph nodes, it's going to get bigger and bigger and bigger. But you also have T cell and slow growing lymph nodes, and you also have advanced stage rapid growing lymph nodes. And you don't have to be old to get either one. It is really unbiased right now when it comes to age. There are patients with standard lymphoma that is 95% common that are 70 years old and just now got it. There are 19-year-old teenagers and young adults that are getting the rapid advanced lymphoma. There is so many different conversations right now about how this is manifesting itself and then not being detected in a proper manner. So going back to lymphoma, lymphoma also causes lymphedema, and that means swelling in other regions of the body. So you won't just have it in the cervical area. You can very well, which is very, very common, you can get it in the supraclavicle region, and it will be a bump that you can't move. No matter what you do, you push on it, you can't really seem to make it pivot left or right. It's not going to be painful. It's not even going to ache. And I'll tell you, if you have an infection in your cervical region and it aches and it's the size of a lima bean, that is completely normal for an infection or just a healthy lymph node in a skinny person or somebody that has had a chronic infection prior within the past 6 months or 8 months. But with lymphoma, it becomes very specific. And you may also have, well, you probably wouldn't know, but you would have lymph nodes in your armpits and in your groin that would seem to persist in swelling. Google is a scare because there's autoimmune conditions that you can have that cause lymph nodes to feel reactive. Okay, you can feel pea-sized lymph nodes in your neck. I have one right here, completely normal. It's completely normal. It's when you start to see an abnormality from what has been shifted. And I also want you to understand lymphoma is one of the most treatable forms of cancer. I have friends with stage 4 lymphoma that have the exact same prognosis as someone with stage 2A. And that is very, very rare with other forms of cancer because of the amount of metastasizing that has happened. But it's the treatment of chemotherapy that is the most challenging thing to accept as either a young patient or somebody that has now been given a cancer diagnosis. And don't allow a physician to either walk you out the door because they think you're in your mind and this is not exactly real. But also don't allow a physician to just tell you, yes, that's lymphoma. You need a full biopsy. If it's a partial biopsy and they get enough tissue to be read, that's fair, but you need a biopsy with that result to be able to have enough information to then go to an oncologist and make them feel assessed in your treatment moving forward. But it is one of the most treatable forms of cancer next to skin cancer, and that is saying a lot. So there has been many people that have asked me to post seminars on medicine on this page. And the reason I haven't before is because I'm not a doctor. I may have as much education as a doctor now, but it doesn't take away from the fact that I'm not allowed to give medical advice. All I can do is put the education out there and then let you guys do what you want with it. What I hope you do is take whatever I say and challenge it to what the experts are saying. Because at the end of the day and at the beginning of the day, all I want you to do is have your best chance at living a healthy life. That is the only reason I ever do anything on this channel, is to help you guys just get out of your mind, get out of anxiety, get out of therapy and thinking that something's wrong with you. It's better to have a definitive answer and to move your life forward. And God bless you all.